every single gynecologist has, before even making a diagnosis of the cause, and before even trying to make a diagnosis of the cause, immediately said, oh, why don't you just take birth control pills? They'll make your cramps less severe. After going to like 15 of these, oh, why don't you try birth control pills, gynecologists, I finally literally insisted on having an ultrasound done and found out that I had cysts in my ovaries and uterus. So at that point they tried to prescribe me large doses of narcotic pain medicine that I refused to take. One of the gynecologists I went to in like 2008 gave me codeine, and then the codeine wasn't strong enough, so she gave me like some kind of stronger narcotic, perhaps oxycodone or hydrocodone, something stronger than codeine. And then when that wasn't strong enough for my menstrual cramps, she tried to prescribe me fentanyl. What are you doing, Eugene?
Just putting dirt on me.
Oh yeah, you want to find out? Ashira, no.
He's getting his nice shirt.
His new shirt.
Hawaii shirt.
And I'm having a dirt bath.
What are you doing now, Eugene?
I'm making dirt in so.
I am standing in my yard where we are cooking burgers and a lot of other food. That looks really good.
Yummy.
And there is my burger. We are out of lettuce and gluten-free bread.
You're not going to use any for swim?
I am now laying down in my room and I'm feeling sick. And as I'm talking, I'm noticing that my voice sounds kind of hoarse. I might be getting a cold or having allergies or something, but that's actually not the reason I'm feeling sick. I'm feeling sick from my period, unfortunately. I get really horrible menstrual cramps for the first few days of my period. So I am now laying down in bed due to severe menstrual cramps. And I would like to talk about why it is so hard for a woman to get actual medical care for conditions that cause menstrual cramps. Because I've been to like 20 different gynecologists at least, if not more than that, who have, once I mentioned that I had severe menstrual cramps, immediately suggested that I should start to take birth control pills without running any kind of tests to see if the severe menstrual cramps were caused by a serious medical condition or a medical condition that could be treated with a medication other than birth control pills or with some kind of surgery, like for example having a cyst or a fibroid removed. Every single gynecologist has, before even making a diagnosis of the cause, and before even trying to make a diagnosis of the cause, immediately said, oh, why don't you just take birth control pills? They'll make your cramps less severe. After going to like 15 of these, oh, why don't you try birth control pills, gynecologists, I finally literally insisted on having an ultrasound done and found out that I had cysts in my ovaries and uterus. So at that point they tried to prescribe me large doses of narcotic pain medicine that I refused to take. One of the gynecologists I went to in like 2008 gave me codeine, and then the codeine wasn't strong enough, so she gave me like some kind of stronger narcotic, perhaps oxycodone or hydrocodone, something stronger than codeine. And then when that wasn't strong enough for my menstrual cramps, she tried to prescribe me fentanyl. Like, I'm absolutely serious. They tried to put me on fentanyl. And I said no because I had no idea what fentanyl was at all at that point. But I did know that one of my friends had been prescribed some kind of patch with fentanyl in it. That friend had like chronic pain, and all of the pain medicine in the world wouldn't do anything for her. So they had given her this fentanyl patch, and she had had a really bad reaction, feeling dizzy and faint, and I think it caused her skin to react where they stuck it in her arm, like somewhere around here. Anyway, all I knew was that my friend who had similar allergies to me had had a bad reaction to this stuff, so I decided not to take it. And now everybody knows what fentanyl is because it's killing millions of people. Luckily, I was intelligent enough not to take something that I thought possibly might make me have an allergic reaction, because I didn't become addicted to fentanyl. But I also didn't become addicted to the other pain medications they gave me, because they made me like so sick to my stomach and so constipated that it was almost worse than the pain. So the last time I took any kind of pain medicine for my period was probably in 2009 or 2010. It's been a really long time. Eventually I gave up on taking pain medicines because they made me have the horrible side effect I just mentioned, and I didn't ever start taking birth control pills because they're really bad for women's bodies in a lot of ways, and I would never consider taking them. And I never had surgery to remove the cysts in my uterus or ovaries because I was actually planning to, and they did another ultrasound and found that one of the cysts was smaller and the other one was gone. And then they gave me an antibiotic that caused me to bleed heavily as though I was having my period, and basically caused the cyst, which was apparently caused by some kind of infection, to dissolve. I hear Evelyn. She's awake now. That means I might have to get back up. I think my boyfriend is taking care of her because he knows I'm resting. Anyway, that is my story of trying to get medical treatment for my menstrual cramps. And the only point of this story is that if a woman goes to a doctor for severe menstrual cramps, before the doctor prescribes any medication, he should make a diagnosis. Severe cramps are a symptom of a disease, not a disease themselves. And there are several medical conditions that can cause them that could be very serious, like cancer. And if you give a woman birth control pills and they do make her cramps less severe, the underlying condition causing the cramps could still be progressing, and if it's something like ovarian cysts or cancer, it could progress to the point where it becomes life-threatening or even kills the woman. And she might not know that this is happening inside her because the birth control pills are suppressing the symptoms. So basically, birth control pills are treating the symptoms and not affecting the cause. I got to quote a Fish song in this video. And that should never be the first course of action. So if you are a woman, or if you're a mother whose daughter is a woman, or a husband whose wife is a woman, or a woman whose wife is a woman, basically if you're a woman or someone who cares about a woman, make sure that when you or the woman that you care about goes to the doctor for severe menstrual cramps, that the doctor first runs tests, second diagnoses the condition causing the cramps, and third suggests possible treatments. Not birth control pills to cover up the symptoms, but treatments. That is the point of this video, and I'm sorry if I am somewhat incoherent during this video because I'm like laying in my bed in horrible pain, unable to take pain medication because of the side effects, and unable or unwilling to take birth control pills because of the side effects. Anyway, please take my advice, and please also like this video, share this video, watch my other videos, and subscribe to my channel.